Interpreting EKGs may seem difficult at first. But once you understand the basic principles, it's actually not that hard. Just follow along with us step by step, you'll soon find that it's easier than you think. And let me tell you, nurses who can read EKGs are truly impressive professionals. First, we'll explain what an ECG is and how the heart's electrical system works. Then, we'll look at the basic waveforms like the P wave, QRS, and T wave. Next, we'll go over a simple 6-step method to read ECGs. Finally, we'll practice the first 3 steps, checking heart rate, rhythm, and P waves. An electrocardiogram, ECG, is a test that records the heart's electrical activity. It helps doctors find problems like irregular heartbeats or heart attacks. It's fast, painless, and can save lives. How to place a 12-lead ECG. For limb leads go on the arms and legs. RA, white, L, black, RL, green, LL, red. 6 chest leads go on the chest. V1 and V2, either side of the sternum, 4th space. V3, between V2 and V4. V4, under the nipple at 5th intercostal space. V5, V6, move laterally toward the armpit, same level as V4. The signal starts at the SA node, the natural pacemaker. Goes through the AV node. Then travels down the bundle branches and Purkinje fibers to the bottom of the heart. This system controls the heartbeat and keeps it in rhythm. What is the cardiac conducting system? It's the system that sends electrical signals to make the heart beat. The first part of the system. SA node, sinoatrial node, also called the natural pacemaker. Located in the top right corner of the heart, right atrium. It starts the heartbeat by sending the first electrical signal. Normal heart rate from the SA node, 60 to 100 beats per minute. Nickname, the boss of the heart. On the ECG, this signal shows up as the P wave. AV node, atrioventricular node, the gatekeeper. The AV node sits between the atria and ventricles. It holds the electrical signal for a short moment so the atria have time to pump blood into the ventricles before they contract. This short delay shows up on the ECG as the PR interval. Bundle of His, the pathway bridge. Located in the center of the heart, this bundle carries the signal from the AV node down to the ventricles. You can think of it like a highway that carries the signal before it splits into 2 paths, left and right bundle branches. Right and left bundle branches, the 2 roads. These branches run along the middle wall of the heart, the septum. They carry the electrical signal down each side, right and left, to the ventricles. Each branch controls one side of the heart. Purkinje fibers, the final messengers. These fibers spread through the walls of the ventricles. They tell the ventricle muscles to contract, pushing blood out of the heart. On the ECG, this big contraction shows up as the QRS complex. How does the electrical signal make the heart beat? SA node sends the first signal, makes the P wave, atria contract. AV node holds the signal briefly, this creates the PR interval. The signal moves through the bundle of His. Then it travels down the right and left bundle branches. It spreads through the Purkinje fibers, this causes the QRS complex, ventricles contract. Finally, the heart resets itself, this shows as the T wave, recovery. P wave, this shows the atria squeezing, atrial contraction. PR segment, time the signal takes to move from atria to ventricles. QRS complex, the big spike. This is when the ventricles contract, the main pump. ST segment, the short rest after the contraction. T wave, the ventricles recover and get ready for the next beat. Intervals, PR, ST, QT, these show how long each step takes. The ECG graph shows each part of the heartbeat, helping us spot problems like delays or extra beats. This slide explains how ECG paper works. Side to side, each small box equals 0.04 seconds, and each big box equals 0.20 seconds. This helps measure time. Up and down, one big box equals 0.5 mV. This shows how strong the heart signal is. So, by counting boxes, you can tell how fast and how strong the heartbeat is. This slide shows the main parts of an ECG wave. Each heartbeat creates a series of electrical events, and these are shown as waves on the ECG. The waves are labeled P, Q, R, S, T, and sometimes U. Each letter represents a different part of the heart's electrical activity during one full heartbeat. The P wave is the first small bump on the ECG line. It shows that the atria are contracting to push blood into the ventricles. Height, 2 to 3 millimeters, about 2 to 3 small boxes tall. Width, 0.06 to 0.12 seconds, about 1.5 to 3 small boxes wide. A normal P wave should be small and smooth, not too tall or wide. The QRS complex is the sharp spike on the ECG. It shows the ventricles contracting to pump blood out of the heart. It usually starts with a small dip, Q, then a tall peak, R, and ends with another dip, S. Height, 5 to 30 millimeters, varies. Width, 0.06 to 0.10 seconds, about 1.5 to 2.5 small boxes. A normal QRS complex should be narrow and fast, showing strong, healthy ventricular action. The PR interval shows how long it takes for the electrical signal to travel from the atria to the ventricles. It's the time between the atria receiving the signal and the ventricles getting ready to contract. Normal duration, 0.12 to 0.20 seconds, about 3 to 5 small boxes. If it's too short or too long, it can mean a conduction problem. The QT interval shows how long it takes the heart's ventricles to contract and then recover. It should last about 9 to 11 small boxes. It can change a little depending on heart rate, age, or gender. This interval is important. If it's too long or too short, the heart can develop dangerous rhythms. So, checking the QT interval helps us know if the heart is recovering properly between beats. The T wave is the small, smooth wave that comes after the QRS complex. It shows the heart's ventricles recovering and getting ready for the next beat, repolarization. Height, about 0.5 millimeters, usually small. Duration, 0.1 to 0.25 seconds, about 2.5 to 6 small boxes wide. A normal T wave should be upright, gentle, and not too tall or flat. This is the 6 steps to read an ECG easily. Rate, is the heart beating too fast, too slow, or just right? Rhythm, is the heartbeat regular or irregular? P waves, are they present, normal in shape, and before every QRS? PR interval, is the time between P and QRS too short or too long? QRS complex, is it wide or narrow? Does it look normal? ST segment/T wave, is there any sign of heart strain, injury, or recovery problem? Step 1. Check the heart rate. A normal rate is between 60 to 100 beats per minute, BPM. You can count the number of QRS complexes in a 6-second strip, then multiply by 10. Or use this quick trick. 300 divided by number of large boxes between 2 R waves. For example, 300 divided by 4 boxes equals 75 BPM. This gives you a fast estimate of the heart rate from an ECG. Using the 6-second method. To find the heart rate, count how many QRS complexes are in a 6-second strip, which is 30 big boxes on ECG paper. Then multiply by 10. For example, If you count 5 QRS complexes, 5 times 10 is equal to 50 BPM. This method is quick and works even with irregular rhythms. Step 2. Check the rhythm. Look at the RR intervals, the space between each heartbeat. If the spaces are even, the rhythm is regular. If the spaces are uneven, it's irregular. Sometimes it's regularly irregular, repeats in a pattern. Other times, it's irregularly irregular, totally random. Also ask, do P waves show up regularly and appear before each QRS? This helps confirm if the heart rhythm is normal. The top ECG shows a normal sinus rhythm. The RR intervals, distance between peaks, are even, which means the rhythm is regular. The bottom ECG shows an irregularly irregular rhythm. The RR intervals are uneven and unpredictable, 8, 9, 10, 13 small boxes, etc. This means the rhythm is completely disorganized, like in atrial fibrillation. A quick tip: use a piece of paper to mark the RR distance and slide it along the strip to compare. Step 3. Look at the P waves. Ask yourself, are P waves visible? Do they appear before every QRS complex? Are they consistent in shape and spacing? If yes, this means the atria are working normally, and the rhythm is likely sinus. If no P waves, it may be atrial fibrillation, as shown in the bottom ECG strip. The top ECG shows P waves present, sinus rhythm. The bottom ECG shows no clear P waves and a shaky baseline, atrial fibrillation. Enjoyed the video? Give it a like and share it with your fellow nurses. We'll keep bringing you more useful nursing knowledge and support.